Welcome back to Timeless Skin Aesthetics. Today it's all about Sculptra. Sculptra is kind of equivocal filler, and it has big time differences from the rest of the fillers we're using in cosmetics. But what's prompted today's video is Dominic coming to me and saying, okay, you know, we did a whole bunch of things. We did threads, we did hyaluronic acid fillers, but I still have some imperfections that I want to address. And she predominantly concerned about areas right over here. That's where she has little wrinkles when she smiles. Smile for me, please. There they are, right? And she still has a little bit of deficiency in her preauricular area. She does have perfect jawline, and that's what was achieved with the threads. The effect is still lasting and it looks beautiful. However, she really wants to do something about that. And then I was thinking about what can we do, and Sculptra came to my mind. Sculptra is not the most popular filler. At the beginning, when it was first introduced, there were a whole bunch of complications, and we'll talk about it later. But right now, with the proper technique and proper dilution and the right dilution, the results that could be achieved with Sculptra are similar to the results that could be achieved with Radius, and the most important part, it lasts longer. Sculptra is not a very forgiving filler. It lasts up to 5 years as far as we know, and of course it does provide the biostimulation effect, but again, somebody who injects it needs to have experience, need to know how to do it, and need to know how to do it safely. Which comes to the point of cannula, which is the safest way to inject Sculptra or any filler, as a matter of fact. We already cleaned her face, and we did the markings, and I already injected lidocaine at the entry points for my cannula. So right now we're just going to proceed with the procedure itself. Sculptra, it's not solution. You see, it's cloudy, it's not clear, it is suspension. There is a whole bunch of polylactic acid particles suspended in the sterile water, where we added just a little bit of lidocaine for the patient's convenience to make this procedure a little bit more convenient for her. So shaky, shaky, shaky. We need to spread the particles all around the syringe to avoid the clumps and to avoid the formation of the nodules. Every procedure with the cannula, the first thing is to form the entry point, and it's done with the needle. It's primed already. You could see the little drops on the cannula, right? And today I will be using the 22 gauge cannula to spread the Sculptra all around. And Dominic feels a little bit of pressure as far as we are advancing the cannula right under the skin, close to the epidermis, and then we slowly, cannula never stops, in very little amounts, we just spreading the solution all around. And we're done on one side, and we're doing a little massage right over here. Once again, shaky, shaky, shaky. And what we're going to do now, again, that's the beauty of the cannula. With just one entry point, we could get into the different areas without making extra trauma to the skin. And massage, massage, massage. And it looks amazing and wonderful. we're going to use 1 milliliter of solution, and we're going to fill your temporal area with one injection, deep injection, that will go directly on the bone and to kind of lift up a little bit your temporal deficiency area. That's it. And this is exactly how we corrected the area around her mouth that she wasn't happy about, with the little wrinkles, and that's going to cause the collagen production. We corrected her preauricular area a little bit, and we corrected small deficiency in the temporal area. Now we're just going to move to another side. And again, nice and slow. That's how we injected a vial of Sculptra, and we addressed the areas around the mouth and the lower cheek. We addressed the auricular area, and we addressed a little bit of temporal deficiency. There is no bruises, there was not a lot of pain. We have a little bit of swelling. The important thing about the Sculptra, with any other filler, if the patient or client is asking me, do I have to massage it? And you go like, if it's gonna make you feel better, you can massage it. With Sculptra, it's different. There is massage 5 times a day, at least for 5 minutes. We want to make sure that these particles of polylactic acid, they're gonna spread. And this way, they're gonna provide the most effect in terms of biostimulation and volumization. Right now, it's a little bit swollen. The swelling gonna go down, of course, because the water gonna get absorbed tomorrow. The most effect, and again, that's the beauty of Sculptra, is biostimulation. We will see it in 4 to 6 to 8 weeks, and Dominic gonna come back and we're gonna make the pictures of it. That concludes our presentation.
Dr. G has performed procedures for me, anti-aging procedures, for about 4 years now. And when I decided to get rid of the wrinkles around my mouth, of course, he found a fantastic solution. And I'm excited to see what this is going to look like in a month.
All the previous experience with the Sculptra was connected to the doctors not diluting it the right way and injecting it the wrong way. So that forms the nodules and granulomas, and after the introduction of the Sculptra and initial excitement about it, it was kind of forgotten. However, for the past 3 years, it's a new favorite filler again. There is old Sculptra and new Sculptra. New Sculptra is more diluted, it's being injected in the deep dermis, and it's used for primary, not volumization, but for the biostimulatory effect. So Sculptra grows collagen. That's what it is famous for. Although it does provide some volume. For Sculptra, you need several injections. So that increases the cost. However, there is much better results long term. Sculptra provides beautiful, glowing skin without these little wrinkles, because the collagen is growing and fill in the gaps and corrects the wrinkles on its own. These results are much longer lasting. Injection of Sculptra is very similar to injections of other fillers, and it could be done with a needle or it could be done with the cannulas. I prefer the blunt tip cannulas with the opening on the side of the cannulas for one particular reason. It's much less traumatic, there is no bruising, there is no pain, and there is a much more even distribution of the solution when the cannula moves back and forth, leaving the Sculptra inside the skin. Sculptra could be used for the correction of cheeks, of the temporal areas. People use it for correction of the and growing and production of collagen, stimulation of collagen growth in the neck area and décolleté area. Could be used to correct the cellulite or to create what is called Brazilian butt. However, the amount of vials that are being used for this kind of procedures is actually much more compared to the face. Today we use just one vial. She's gonna come back in 4 to 6 weeks and we're gonna reevaluate her. It will produce the long-lasting results with biostimulation of the own collagen growth, and everybody's extremely happy after 6 months, and these results again, they're lasting very long.
Hey guys, it's me, Dominique. I saw you about 4 weeks ago. I came in, I was noticing some fine lines and wrinkles in my face, bothered me a little bit, so I wanted to feel more invigorated, which of course has happened. Dr. G gave me injections with Botox around my eyes, and we did Sculptra around the mouth to remove fine lines and wrinkles there. I feel fantastic. I'm so excited. I feel more powerful, just ready to go, more youthful. It's been fantastic. It really has. And Monday, I'm going to start selling Ferraris.